Exploring the uses of Trazodone. How it can help with mental health issues. Trazodone is a medication that is used to treat various mental health conditions, such as depression and anxiety. It is an antidepressant that works by blocking serotonin receptors so that the brain can better regulate its production of serotonin, which is a neurotransmitter that helps regulate mood. By restoring the body's balance of serotonin, Trazodone can help reduce symptoms of depression, anxiety, and insomnia. It has been found to be effective in treating symptoms such as low energy, lack of concentration, and changes in appetite and sleep patterns. In addition, it can help reduce feelings of agitation and increase feelings of calmness and relaxation. Many people find that Trazodone helps them cope with their mental health issues and can even improve their quality of life. This video will explore the uses of Trazodone and how it can help with mental health issues. What is Trazodone? Trazodone is an antidepressant that is used to treat various mental health conditions, such as depression, anxiety, sleep disorders, and chronic pain. It is commonly used in combination with other medications or as a standalone treatment. Trazodone is in a class of medications called serotonin reuptake inhibitors, SSRIs. SSRIs are a type of antidepressant that works by blocking the reabsorption of serotonin so that the brain can better regulate its own production of serotonin, which is a neurotransmitter that helps regulate mood. Along with SSRIs, doctors often prescribe Trazodone for people with treatment-resistant depression, anxiety disorders, or insomnia. How does Trazodone work? Trazodone works by blocking serotonin receptors in the brain so that the brain can better regulate its production of serotonin. Serotonin is a neurotransmitter that helps regulate mood, and many people with depression have lower levels of serotonin. Trazodone is a serotonin reuptake inhibitor, which means that it blocks the reabsorption of serotonin and increases serotonin in the brain, helping to regulate mood and reduce symptoms of depression. Trazodone is also sometimes prescribed as a sleep aid because it helps increase serotonin, which helps you sleep better. Trazodone can also be used to treat anxiety, as serotonin helps regulate anxiety as well. Trazodone can also be used as an antidepressant for people who don't respond well to SSRIs. Benefits of Trazodone. Depression. Trazodone is effective in treating symptoms of depression, such as low energy, lack of concentration, and changes in appetite and sleep patterns. It can also help reduce feelings of agitation and increase feelings of calmness and relaxation. Since depression is often accompanied with sleep disorders, Trazodone is also sometimes used as a sleep aid for people with depression. Anxiety. Trazodone is also sometimes used to treat anxiety disorders, including generalized anxiety disorder, GAD, panic disorder, and obsessive-compulsive disorder, OCD. Chronic pain. Trazodone is sometimes used to treat chronic pain, as it can help reduce pain and improve sleep and mood. Positive side effects. Trazodone can also help improve your mood and energy levels, and it has been found to reduce cravings for substances such as alcohol or opioids. Common mental health issues treated with Trazodone. Depression. Trazodone can be used to treat mild to moderate levels of depression and is most often used in combination with other antidepressant medications. Anxiety. Trazodone can help reduce feelings of anxiety and feelings of restlessness or jitteriness. Sleep disorders. Trazodone is sometimes prescribed as a sleep aid for people with insomnia or other sleep disorders. Substance use disorder. Trazodone can help reduce cravings for substances such as alcohol or opioids and can be helpful for people with a substance use disorder. Eating disorders. Some research has suggested that Trazodone can be an effective treatment for people with an eating disorder, but it has not yet been approved for this use. Potential side effects of Trazodone. Sleepiness. Some people experience sleepiness while taking Trazodone, which may decrease as they continue to take it. If you feel drowsy while taking this medication, you should avoid driving or operating heavy machinery. Weight gain. Trazodone can cause weight gain in some people, and it has been linked to a higher risk of diabetes. Sexual side effects. Trazodone can decrease sexual desire in some people, although this is less common in women compared to men. Muscle spasms. Trazodone can occasionally cause muscle spasms in some people. Abnormal bleeding. Trazodone can increase your risk of bleeding. If you are taking a blood thinner or are at risk for bleeding, talk to your doctor before taking Trazodone. Dosage of Trazodone. The dosage of Trazodone will vary between individuals, based on factors such as age and health. The recommended dosage of Trazodone for adults with depression is 50 to 100 mg per day, taken in divided doses. The typical dosage for anxiety disorders is 50 to 100 mg per day, but it can also be used in higher dosages. The recommended dosage for adults with insomnia is 50 to 150 mg per day, taken at bedtime. The maximum dosage for insomnia is 300 mg per day. The maximum dosage for depression is 300 mg per day. If you are taking an antidepressant, it is important to take it as prescribed. If you stop taking the medication too soon, your symptoms may come back, and you may need to restart treatment. If you have been taking antidepressant medications for an extended period of time, longer than a few months, talk with your doctor about whether it is time to taper off the medication. How to get Trazodone. If you are interested in taking Trazodone, you will first want to speak with your doctor. They will be able to determine whether it is the right treatment for you and can help you get it prescribed. If you are going to the doctor for the first time, make sure to be prepared. Bring a list of all current medications, vitamins, or supplements that you are taking, and a list of any medical conditions you may have. Your doctor will want to know what your current mental health issues are, and any other health concerns you have. If you are already taking antidepressants, your doctor may suggest that you try a different medication. They may also suggest adding Trazodone to your current treatment. If you have health insurance, it will cover the cost of your treatment. How to take Trazodone. If you are prescribed Trazodone, follow your doctor's instructions and take the medication exactly as prescribed. Don't stop taking your medication without talking with your doctor first. If you are having trouble sleeping, you may want to take Trazodone in the morning. Trazodone can cause drowsiness in some people, so it is best to take it when you are less likely to be active. If you are taking this medication for anxiety, you may want to take it before you go to bed and before you eat dinner. If you are taking this medication for depression, it can be taken either in the morning or evening. If you are taking this medication for insomnia, it is best to take it right before bedtime. Alternatives to Trazodone. There are a number of different antidepressants that can be used to treat mental health issues. If you want to try a different medication, talk with your doctor about other options. If you are taking Trazodone for depression, you may benefit from switching to another antidepressant. Some other antidepressants that can be used to treat depression include fluoxetine, Prozac, sertraline, Zoloft, paroxetine, Paxil, citalopram, Celexa, escitalopram, Lexapro, and fluvoxamine, Luvox. If you are taking Trazodone for anxiety, you may benefit from switching to another antidepressant. Anxiety can be treated with a variety of different antidepressants, such as SSRIs or tricyclic antidepressants. If you are taking Trazodone for insomnia, you may benefit from switching to another antidepressant.